Welcome, everyone, to an American Discussion podcast. I'm one of your hosts, Michael, and with me, as always, is Drew. How are you doing today, Drew?
I'm doing pretty good, Michael. How are you?
I'm doing well. Having a pretty good weekend so far.
Oh, yeah? What'd you do?
What about yourself? We went to a little festival and parade that happens in my hometown every year. I know you're familiar with it. You used to go with me sometimes as a kid.
Yeah.
Took both of my kids. It was really their first time going to a parade.
How'd they like that?
You can believe that. They loved it. I mean, they both came home with a bag full of candy. So, what more can you ask for when you're a 3-year-old and a 5-year-old kid?
Yep, absolutely.
We browsed around the shops a little bit and found some stuff. Brought home a bottle of cinnamon and vanilla infused maple syrup.
Ooh, that sounds
from
delicious.
Michigan. Oh yeah, it was very good. I don't see myself using it too often, but
Use it as like a glaze on something.
Yeah, once in a while, maybe on some pancakes, or making some kind of dessert topping, something like that. I bet it'll be good.
Mm-hmm.
What about you? What have you been up to?
Pretty calm weekend for me. Kids are at the in-laws for cousin weekend, so we've the wife and I have just been hanging out. Had a little movie night last night. Nothing too crazy.
Oh, that's got to be nice.
Yeah, it's been relaxing. Getting up at 9 o'clock instead of 7 o'clock every day, so that's a pro for sure. Anyway.
All right. Well, yeah, sounds like we both had a pretty relaxing weekend, and we're ready to get back to work, huh?
Yeah, let's get it, because I've been saving up the energy all day for this. I've been in my little metamorphosis cocoon, just gathering strength.
Well, it's time to emerge.
Let's do it. So, from today's butterfly effect, we're going to be talking a little bit about state institutions, where they came from, predominantly focusing on America, obviously, seeing as that's the point of the podcast. This kind of came to the front of my mind after a conversation that my wife and I had about the mental health situation. Which, first of all, crazy thing being an adult that we're talking about a nation's mental health problem as casual conversation. But here we are. So first thing I want to go over is a little bit of history on it. Introduce kind of everybody to the topic. I know it's something that we all kind of see the effects of in our daily lives, and we all know that it's messed up, but we don't know, one, how it got there, which I think is a big portion as to how we move forward and look at solutions for it, kind of what has worked, what hasn't worked throughout time. So I gave you that presentation so we can both kind of follow along on it. I'm going to breeze pretty quickly through the historical wickets, and we'll be referencing those as well as we go. But a lot of them are big events, and we'll kind of break them down from there. So the first recorded institution was found in Baghdad in the 7th and 8th century. Now, there could have been state-led institutionalization before then. They just, for whatever reason, the records either weren't kept or have been lost to history. Up until the United States and the UK in the 1800s, late 1800s, most of them were private institutions, right? There was very little access for your common man, especially your, as far back as your peasants of the fiefdoms. Most of them were not getting mental health care, right? It was predominantly for the upper class, or in societies that had a middle class, the middle class, but very rarely seen at the bottom ends of the economic spectrum. So the first one opened in 1773 in the U.S. It was Eastern State Hospital, Williamsburg, Virginia. That's the first one we saw in America. Again, that was a privately owned one. This is where we start seeing some of the more crude treatments, not necessarily based in therapy, but more based on physical acts, right? So this is where you're seeing your lobotomies, you're seeing your isolation, restraints, things of that nature. Lobotomy is less such at this time, but they do start to become more prevalent as the following century comes. Then we see in 1796 the York Retreat opens. It's the first reformed asylum. What this does is it switches from a disciplinary, like corrective measure of physical force, into a therapy-based system. So this is when we start to look more at the root causes of mental health. Obviously, it's in the late 1700s, so our understanding of that is very, very minimal at the time, but this is where that all starts. So from 1796 to 1890, just shy of 100 years, every state has at least one publicly funded medical hospital. So this is where we first start seeing state institutionalization on grand scale, right? And even then, this is also, like I said, how it used to be private institutions. This is where we start seeing help being available for lower class entry. It's still not very prevalent for the lower socioeconomic classes within America, but we start seeing that movement in that direction.
Okay. And so while you were doing your research for this topic, how much were you cross-referencing this with the, like, I guess, mental health treatments of the time, or the current, or I guess rather contemporary understanding of what mental illness was?
So that's a really good question. This comes out to a few different time periods, right? So until we start seeing the late 1800s, until that time period, we're really not getting an understanding of mental health at all, right? It's a lot of the parent-child dynamic where we discipline what we see as a bad action. And that's for most of human history up until about the 1800s. In the institutions that we in America and in the UK opened up and started studying, right? There wasn't a whole lot of psychological analyzation of people up until that point, mainly because they had other shit to worry about, right? They were worried about disease and scarcity and all of that stuff, right? One person that was hugely instrumental in America is Dorothy Dix. I don't remember if I have a slide in here on her, to be honest with you. Oh, I do, actually. She's huge in exactly what you're talking about, in making a public conversation of the trying to understand mental illness instead of disciplining it. At least in America, she's the biggest advocate for that in American history, in my opinion. And she's the one that comes up if you look up this issue in the United States. She's the predominant figure.
Okay. Now I am fairly familiar with this topic as a whole, being as I studied psychology for a while in college, and I was very interested in it in high school. I was actually able to tour an abandoned mental institution while I was in high school.
That's awesome.
An institution in the state of Colorado. Very, very creepy, eerie experience, but also very educational. We can talk about that if we have some time, but I don't want to take too much away from what you brought to the table here today. What I did want to just throw in a little bit is that along with this timeline, you kind of see that shift from, the understanding of what people going through, serious mental health crises was back, before the, late 1800s, like we were talking about, when you have people like Sigmund Freud really coming forward and, starting to analyze the mind and the brain. And then, later on when we realize, hey, these are medical issues and they can be treated, with medications and therapy and things like that. So,
absolutely, and that's another flaw in my research here, is that a lot of mine is from a policy standpoint and not so much at the individual standpoint, right? So I tried to, just for sake of time and for brief understanding, I tried to not get too deep into the weeds on any one thing. And try to just see how we as a nation have prescribed policies to try to address this issue, right? So no, absolutely, Freud's huge as far as the understanding of it goes and how we start to. but I don't have a whole lot of him in here, especially because he is kind of a controversial figure within this realm as well. Nowadays, he was very much not. He wasn't as much back in the day, but today I think he's a little bit more controversial. I could be wrong, but
no, absolutely.
At least from what I've seen. So then after the 1890, we don't really have much change up until the 1950s, right? We do start to see a lot of legislation being considered because of the advocacy that Dorothy Dix has pushed forward. She's in multiple speeches all across the nation. She would address both houses of Congress, politicians of all levels, whether it be local, state, national, whatever the case may be. So she was huge in that time period, but unfortunately not a whole lot came from it, besides the public funding of institutions. She was huge on that, and the expansion of the program to go nationwide instead of just individual states. 1954 is the next big jump. That's when we see Thorazine released, and it's the first antipsychotic to come to market. But just like most drugs, once that one came to market, a bunch more similar ones came after. But this is where we see the first medication, showing that this is treatable and not like a God-given blight on humanity, right?
And when you say that Thorazine is used or released as the first antipsychotic, you're talking about like a medication that can be prescribed to somebody, sent home with them so that they can, live a relatively normal life, right?
Correct. Yep. It's some sort of treatment for it. They see it more of a physiological issue than a mental issue, if that makes sense. If I'm describing that correctly.
Now, one thing I can add to the conversation here is that previous to that, certain patients had great success with lithium, and I believe that was introduced around the turn of the century, around the year 1900. I could be wrong there, but I don't know what kind of application
efficacy
that had. For efficacy. I don't know how effective it was. I know it was a huge breakthrough and it helped a lot of people, but I don't know if that was the kind of thing that you could be prescribed to take home. I don't know what the route of administration was, but.
And I didn't get too deep into the weeds on that one either. I saw it as an option, but I also saw it had some pretty bad side effects, especially within. It would help with a mental health issue, but it could also cause a litany of others. So. And it also was not originally marketed as strictly that, right? It had a bunch of other uses. That's why I picked Thorazine, because it came to market as an antipsychotic, right? Or an on-label prescription, as we call it now. So after that, we get into the 1960s. So Thorazine comes out in 1954. 1960 is when we start deinstitutionalization. Right? Now that we see that people can indeed, like you were saying, go back home and treat themselves to an extent, we start to see less and less need for public institutionalization as a country, and so they start phasing that out. Another large portion of that was maltreatment of the patients, and we get into a lot of the more libertarian conversations as far as individual liberties and things of that nature that were being infringed by the institutionalization of citizens. After that, we see 1963, JFK signs the Mental Health Act. We'll get into more of that later. 1965, LBJ signs Medicaid into law. This actually, it can be argued kind of either way as being a good thing and a bad thing. As a general policy, my argument is that for mental health, it was heavily detrimental.
I'm not familiar with that particular piece of legislation. Could you explain a little bit about?
I will further in the thing.
Okay. I'll hold my question.
No, it's a good question. I do have another slide in there coming up that gets a little bit more into that. Obviously, we're not historians, we're not anything like that. It's just for conversation's sake, right? So, and then 1980s, and when we start seeing the mass closing of a lot of public institutions, this is because of funding issues that arose from this Medicaid law, right? We're starting to see the trickle-down effects of that 15 years later, which is not uncommon for policy impacts, right? A lot of the times we don't see impacts from policies until 10 years down the road. And that's common on everything, not just this issue, right? 1980s, we start seeing the mass closing of most public institutions, and in 2015, so 35 years after the closing of the public institutions, the last institution closes in America. So that's kind of where we're at as far as the timeline on here. Most of the changes occurred from the early 1800s into the late 1980s. So over the course of about 180, 200 years. So I want to go through a couple of treatments that were common throughout the lifespan of institutionalization. This is not, I'm not breaking it up in a time period. This is just things that we've seen across the board for treatments in these. So as high as capital punishment, they also had chain restraint, bloodletting, occupational therapy, psychiatric therapy, common labor jobs. This is things like farming, small industrial projects, mining. It all depends on where the location of the institution was, what those jobs kind of pertain to, right? A lot of livestock, which was unbeknownst to them, but actually has therapeutic value nowadays as well. They also got into isolation, which was big and, as we now know, very damaging to mental health, as a lot of these are.
You could, a lot of these therapies nowadays, I wouldn't necessarily call them therapies, because you could really be causing mental health problems in somebody that didn't have a pre-existing issue.
A lot of these things are actually on the Geneva Convention as torture, right? So they're not even allowed to be used in war anymore. So, no, they're pretty crazy, some of them. They also got new electroshock therapy, forced drugging, lobotomies, ice baths. There's a lot more. These are just the main ones that you see across the board. Common labor jobs is one that will make a reappearance later on. So, a little bit of foreshadowing for you there. So next one I want to get into is talk about the switch of cruel to more humane therapeutic methods. Right? I use the word therapeutic very loosely here, especially towards the beginning. The original treatment for institutions when they were privatized was based on compassion, right? It was the therapy, the rehabilitation of that person, and the reason for that is very obvious in my opinion. If people are going to be paying for the treatment, quote unquote, you can't be killing people, right? You can't kill your patients. This is where I think capitalism really came in and helps with more compassion, actually, is that people aren't going to pay for the services if you're killing them, right? So that benefit there helped keep it kind of on the straight and narrow for the beginning, at least in America, right? This is where your Dorothy Dix comes in, and she talks a lot about being more compassionate to people. The big problem we ran into where we start to see the switch is the overcrowding of institutions when it's made public, right? And just like we see in the prison systems nowadays, overcrowding is where most of your problems start to come in. You get too many people in a small space, bad stuff happens. Individual care becomes less and less common once that overcrowding happens. Because you have more people, that doesn't mean you necessarily have more funding or more staff, so your ratios of staff to patients starts getting further and further apart. Once this happens, we start slipping back into the old punishment ways, right? This is another pretty common human nature issue that we run into, where it's easier to discipline someone than it is to reform them, right? We start seeing that in the prison system nowadays as well. This also comes on the back of a bunch of studies at the time that came out and stated that the old ways were effective. And this is also when lobotomies become much more common, when you start seeing this overcrowding in these public institutions. Thankfully, lobotomies didn't last as long as they could have. Last one was performed by Dr. Walter Friedman in 1967, and there has not been one in America since.
Now, that's interesting. And you say 1967 was the last one. That still seems far too recent based on our
100%
understanding of medical sciences at that time. I mean, we were effectively treating
100%.
many illnesses and, understanding the mechanisms behind them by then. But we were still, driving an ice pick into the frontal cortex of someone's brain.
Oh, absolutely. If there's one thing that this research has taught me, it's that our understanding, of the brain is very fickle, right? We don't know a whole lot about it. and even to this day, we really don't know as much as it's portrayed that we do. And so the beauty and one of the cons of democracy is that everyone gets a say, right? So if we have Dr. Walter Friedman, who made his career on lobotomies, right? His whole thing was mental health, and lobotomies was his cure-all for it. And if you have an influential doctor talking to a bunch of people, when the education rate is low, for example, it's easy to convince a population to do bad things for good causes, right? I would argue this is what we saw in COVID as well, but not to that extent, obviously. But this is also when reforms begin to gain momentum, right? I put the wrong word in there for the presentation, but nobody will see that. So a couple of people that caused the decline, right? When we start to see the transition away from the old asylum model, Dorothea Dix, like I said, was huge in this. And I talked about her a lot already, as far as her speeches with politicians, and trying to use an appeal to their humanity to help people, right? She was known as the voice of the maniac, because she would go in and she would talk to these criminally insane people that are doing horrendous things, and she's just trying to get an understanding, right, of why they do what they do. But she's also of the belief that, hey, just because they have a mental condition doesn't mean that we can treat them like second-rate citizens, right? They still deserve all of the same humanities that the rest of us have. Be able to be clean, be able to have medical treatment, to be able to have food and water and shelter and all of these things, and to be treated like human beings, right? And she was huge on that.
And now that does seem very in line with what the original private institutions were all about.
Correct.
At least that's the romanticized idea that we see in the history of this topic. Because those private institutions, in the 17 and 1800s, they were really open with the idea of getting those people to a place where they could be treated kindly and with compassion, because
exactly,
they would not be in general society.
Yes, and that's what we were talking about a little bit ago with the switch, right? We go back and forth. It started good, and in the middle, and this is what I think is a testament to the government being bad at setting up projects like this. We start to see good when it's privatized in the beginning. The bad part of that is that the lower class still has no way in, right? They're still left untreated, unfortunately, because they cannot afford the treatment. Then we get the nationalization of it, and then we immediately start seeing overcrowding of these institutions, underfunding of these institutions, and this is where everything goes awry. And then we start coming back. So back to your previous point of 1967 being very recent, as far as the mental health understanding and to still be doing lobotomies. 1946 is when the National Mental Health Act came in, and this is what created the National Institute for Mental Health. So this is when we start being able to study on a national scale mental health and the implications of that, right? So only 12 years before the last lobotomy is when the first National Institute for studying this stuff comes about. Before then, you have politicians speaking to doctors, but you don't have any type of organization for it, right? 1955, the Mental Health Act comes out. This establishes the Joint Commission on Mental Illness and Mental Health. So what this does is this allows the NIMH to start doing studies, and it allows them to start having a better understanding to an extent, right? This is where they get a lot of their research done on mental health and the funding for that research. So then 1963 happens, and we get the Community Mental Health Act. This was a... that first wicket's wrong. There's a copy-paste there, my apologies. This allowed states to establish local mental health centers and alternatives to institutionalization. So this is one of the things that it sounded really good theoretically. It brings it down from an upper level and allows local communities to handle the situation through a government rubric, right? So it tells you how to set up smaller scale that really focuses on outpatient treatment, right? It's not designed to house people. It's designed to allow for therapies, for the prescription of antipsychotics and other like medications. But the unfortunate part of it is, while it did make it not necessarily a mandate, but start the transition away from the institutionalization, it was a classic political bait and switch, where they got the act passed, and then most of the centers were never built. I don't remember what the exact percentage was, but it was in the high 80s were not built. And the ones that were built, none of them were fully funded to the letter of the law, or funded to the letter of the law for the duration of them being open, right? So we start to see that declining, also leads to overpopulation, and so on and so forth. 1965, we start seeing the Medicaid adoption, and this further crippled the funding for the mental health system within our nation. This is what it basically does is it breaks. There used to be funding set aside for mental health, right? And it could be doled out individually based on whatever criteria they decided, right? What it transitioned from that, from being able to do individual fundings, it converted it over into block grants, right? So it gave more money to certain blocks of projects, but it did not allow for the expansive research of multiple institutions across the country. A block of money got sent to this state, and that state doled it out to the one or two organizations that they deemed necessary. This also took a lot of the funding and shifted it from treatment and into research, which obviously research is necessary, but this is why you lose a lot of your funding for the running of these community treatment centers. In 1966, we see the Supreme Court case Lake v. Cameron. This is where the Supreme Court dictates that all this mental health treatment should be done in the least restrictive setting. This is where you start to see the wording, at least, not the regulations, that you have to quickly discharge patients to the least restrictive environment possible.
And by that, you correct me if I'm wrong. You're saying, so if someone was institutionalized, once they are, say, well enough on medication to be put into maybe an inpatient program, they get moved there as soon as a doctor says they can, and from there, as soon as they're well enough to do outpatient, they move to outpatient. Yes. And as soon as they are able, and I say able in air quotes here, able to be sent home with medication, that is what happens as well, right?
So that was the intent, right? That was that's not what was spelled out in the law. The law was actually the ruling was actually very vague there, but it's where we start to see that intent, correct? The next year is when we see all of that actually written into the law, right? With the Lanter and Petrus Short Act. It's named after the California senators, and I want to say there's, I don't remember what the other guy's job was. He was another politician, but he wasn't a representative or a senator. But for sake of this, it's not really important. What this does, the biggest one, is it ends indefinite and involuntary commitment, right? So since then, the Supreme Court deemed that no one can be imprisoned forever strictly because of mental illness, right? Now, we still have to this day people that are permanently committed to prison for crimes that they committed with the caveat of their mental illness, right? So insanity pleas and things of that nature. It also shifts the responsibility from the states to the counties, and what this does also cripples the small-scale centers, rehabilitation centers, because the funding now gets broken up, right? So instead of the state being able to put them in strategic locations, the funding now gets cut way smaller, sent to smaller municipalities that don't have enough money to open a center, but they have enough to maybe hire a doctor that can do prescriptions, right? It really cuts down on the quality of treatment across America. But that was done with the intent of closing a lot of our institutions, right? Which is why they did it. It also provides in law that there has to be a prompt evaluation and treatment of serious mental disorders, and they also include chronic alcoholism, which, as an alcoholic, I think is a mental illness, but whatever. That's up for debate, I'm sure. Because before this time, they could just lock you up, and a doctor might not see you for 6 months, right? So a doctor can't deem that you're good to get out if they've never even seen you, right? So this makes it a requirement that there has to be a prompt evaluation. It also puts in law the allowance of a 72-hour hold, which is the time period in which you have to be evaluated in. So it goes from no amount to 72 hours, which I think is good. But then it also gives the ability for that psychiatrist to deem a longer hold, which is a 14-day hold, and that's only for involuntary, right? That's if you've committed a crime or you've been recommended by your peers or your family due to some incident. And then that can also be a time in which a patient can be referred for conservatorship, where, for those that don't know, conservatorship is what Britney Spears was just going through, right? Where somebody else is put as the responsible party for pretty much every aspect of your life. It basically infantilizes the individual and gives someone else the power over most portions of their life. This is the bill that allows that to happen.
It's essentially like a power of attorney, but your own personal power is stripped from yourself.
Correct. Yep.
And then just while I'm talking for a second, you said something about alcoholism and mental illness. And I will say that alcohol use and substance abuse disorders are considered mental illnesses universally now.
By institutions, yes, but what I mean is by the individuals within society, right? Other American citizens may not deem it to be one, and that argument can ensue from there. It was all I meant by that. At a national level, and the NIH, they all deem those as mental illnesses, 100%. That was just individuals having the conversation, because there's arguments that I can kind of see. It's something that if you never do heroin, you'll never get addicted to heroin, right? I don't think it's a humane argument, but I can at least see the grounding for the argument. Again, I don't hold that belief, but it's an argument that I think there is some level of justification, albeit very small. Back to the timeline, we get to 1973, Souder versus Brennan. This one is the one that I think should have a prison equivalent. I don't know that it does. I didn't look into this, but what this does is the Supreme Court says, hey, if you're institutionalizing these people and you're having them do labor jobs, like we were saying earlier, like farming, livestock, industrial widgets, whether it be license plates or whatever, and it gives any monetary benefit to the establishment, they're required to be treated as an employee, and they're required to be paid that state's minimum wage for hours worked. So this really gives a lot more humanitarian appeal to the system, because before then, obviously, the people were doing all the labor and getting none of the rewards. And this also incentivized people doctors to keep people in longer to maintain a workforce, as we also see in the prison reform, in the prison system today. In 1975, O'Connor v. Donaldson made it so that mandatory institutionalization is only allowed if that person was a direct threat to themselves or others. So this is where we get our modern outline for what most people, I think, most decent people would agree, should be the rubric for stripping someone of their freedoms and shoving them in an asylum, right? You start seeing that if they're not harming someone themselves or others, then they should be able to fight through this on their own if they so choose. And that kind of brings us up to the modern day. Obviously, there's more wickets, like we said, 2015 is the last institution closes and things of that nature, but that's the bulk of the legislation that has been passed. The ACA, the Affordable Care Act, changed a few things in it as well, but I didn't honestly have time to dig too deep into that. It's a huge document. One thing I've learned from looking up old policy to new policy is they just keep getting longer and longer and longer. which, makes it much more difficult to look these things up. And they become a lot more legalese as well. So that kind of leads us to where we're at now, which is something where I think a lot of the discussion comes from. So here's just a couple of stats. Most of these are from SAMHSA, which is the Substance Abuse and Mental Health Services Administration of the United States, obviously. And the other one is the DHUD, and this is the Department of Housing and Urban Development. So what these two things do is they kind of say, hey, if we got rid of institutionalization, obviously we didn't get rid of mentally ill people, right? They still exist, they still need treatment, and they're still out there. So where did they go, right? So as of, which is this one? I think this one was 2022, but I didn't write it down for whatever reason, so I apologize for that. 44% of the jailed population suffers from mental illness. This is 37 in prisons, and both of those are compared to 18% in the general population, right? So we're seeing over double concentration in jails and prisons. Now, there's an argument that people with mental health issues commit crime at a higher rate because they're not mentally stable, right? That makes sense to me. People that are troubled and need help and can't get it can resort to other means, right? And whether that be blame to them or society, who knows, right? So we're seeing a large population of our mentally afflicted people, citizens, incarcerated, and the remainder of them seems to either be untreated or be homeless, right? So 21% of homeless people, as per the SAMHSA, in 2022 were found to have serious mental illness. Now, this kind of statistic is kind of all over the place, right? It's a broad number. A lot of studies have been done, and they all find things in different ranges. So just a year later, in 2023, Department of Housing and Urban Development stated that 31% of homeless people have a serious mental illness. This is something that would take a little more digging into to get into specifics of which one would be more accurate or not, but I just want to give the range of what we're looking at. What things are deemed as serious, what ones aren't, the number of people in the study, the number of Americans, because there was also, for the SAMHSA studies, it was, I think it was 60,000 homeless were studied, bulk of them in America, but some also in European countries as well, such as the UK and Germany. So, who's included in what, cultural differences in what can change that number. 67% of homeless currently, this is according to the SAMHSA, are found to have some sort of mental illness. So pretty markedly over half of the homeless people in America today have some form of mental illness, right? And this also makes sense, right? If you have somebody who's not mentally stable or they have some kind of mental illness, it could be harder for them to coexist with their small network social groupings, whether it be families or churches or whatever the case may be. And so they end up being removed from those, and they have nowhere to go. So we start to see a lot more homelessness. An interesting thing that we do see, this was interesting to me, I don't know why it's this way, I'm sure it's something to do with the psychological differences between men and women, but we do see a higher propensity for mental illness in men compared to women. That's also reflected in the higher suicidality of men than women. So as of this study, we see 67% of men and 57% of homeless women have some form of mental illness. Another thing we're seeing in the homeless population is a vast increase of some of the more concerning mental health issues. I know that the schizophrenia rate is significantly higher. I forgot to put the stat on here, so I'm not going to quote that one. But the one I do have is bipolar, right? So according to the National Institute for Mental Health, we have 0.7% of the general population is diagnosed with bipolar, where we see 8% of the homeless population is deemed to have diagnosed with bipolar disorder. So to wrap this all up, basically what we did is we started at less people being able to get health coverage for these mental health illnesses, but they're doing pretty, in my argument, humane treatment methods. To nowadays, we have eliminated, due to what I've looked up, mostly funding issues, we've transitioned into a system where we, instead of having them in these treatment centers, they're now in our jails, in our prisons, or on our streets, which has cascading effects into many other public policy theaters, right? Your crime statistics change, your single-family statistics change, everything all the way down to children learning in school is changing, right, because of these things. As for how to fix it, I don't have that answer, but I think that opens up discussion now for what we think we could do to maybe help the situation. Again, this was not all-encompassing, but I hope it helps people at least get a general understanding of the timeline of what happened to our institutions, and why we went from a nation that has something out there for people to one where we just kind of push them onto the street, right? Which I don't think is the answer.
Yeah, absolutely. And I just have a couple of things to add here.
Yeah.
So I guess I'll start out with your statistics here at the end. So when you're talking maybe between 20 and 30% of people having serious mental illness, or the homeless population rather, yes. I don't know about these specific statistics, but generally when statistics like this come out, they do not include substance abuse disorders.
Correct. Yep. No, those are not included in this series.
Statistics. So that is your mental illnesses like bipolar, borderline personality disorder, schizophrenia. Yep. All of those kind of things where you might be having some sort of paranoia or delusions or some sort of altered sense of reality.
Correct.
Some problem with decision making, that sort of thing. So, just to touch on it, because this is a big educational opportunity for me anytime it comes up. Bipolar is not something where someone is switching back and forth in their emotions all the time. Like 1 second they're very angry and the other second they're happy.
Oh no, this is waves.
Bipolar disorder is generally characterized by weeks to months of deep depression,
mm-hmm.
followed by days to weeks to sometimes months of manic episodes, which is somebody almost in a sometimes a euphoric state.
Yep. Or
just like a charged, energized state, and they're just not in their normal normal mind for decision making, and what would generally be stopped by your impulse control would not be with somebody having a manic episode. So during a manic episode, you could think that going and robbing a corner store is like the best idea you've ever come up with, right?
Yeah.
It's not necessarily somebody that just, cleans their house all day, or, like I was saying, flips back and forth in their emotions.
Yeah, so I actually am very close to someone with this. You and I can talk off podcast about the individual. But I've seen it firsthand for quite a long time, and what you're describing is exactly accurate, right? So there'll be a couple of days to a couple of weeks of this person being completely fine, right? Being a normal functioning member of society. They're happy. They're getting all the experience, the up emotions of experience. And then it starts to sway into something a little more dark, right? And I don't mean outwardly violent. I mean, while that is an option, while that is a possibility with this disorder, it's not the one that the person I know is affected with. But they tend to get more in the depressive side of it, and the self-criticization, being self-critical of themselves and things of that nature. And it really it's sad to watch happen, because that person's struggling, right? And you want to help them the best you can to help them get through it. And I've also seen that medication for that is greatly beneficial in this anecdotal case, right? It really helps even out. From what I've noticed, and again, we're no doctors, from what I've noticed, what bipolar does is it spreads out emotion over long wavelengths, right? So they'll go up for a long period of time, and then it starts going down, and it's down for a long period of time, where throughout our day, that wavelength is much shorter for people without this disorder, right? You can go up and down all in the same day, where we start to see for bipolar more up for a prolonged period of time and then much more down for a much more prolonged period of time.
Yeah. And I totally agree with that.
Yeah, it's something that, and if you get the kind that gets you more aggressive or violent in that down, which I don't know for sure, but I would assume is more likely in men to be more aggressive just because of testosterone, it's very easy to see how someone could lash out violently to other members of society.
Yes, and it's not just violence, right? Like, that brings me to my next point, which was the reason that this is such a unique and difficult issue to get a handle on is that mental illness is not something that you can, to use the old cliche, pull yourself up by your bootstraps and
Correct.
Carry on with your day. So one thing that, as I briefly mentioned, I got a chance to tour an abandoned mental institution that was, on the same grounds as a functioning mental institution. I was able to talk with some of the patients that, volunteered to help educate, us. I think we were seniors in high school at the time.
Yeah.
And the common theme between all, a half dozen of the people that we talked to was that mental illness, even if you are on like a good medication regimen and everything is looking up, your normal brain, or perhaps it is your, that mentally ill part of your brain, even while on your meds, will trick you into saying, I've recovered. I don't need these medications.
Yep, I'm cured.
Right?
The problem's solved.
Yeah, I'm cured. I don't need this. And then you stop taking it, and then it's just a vicious cycle because now your mental illness, especially if you have something like borderline personality disorder or schizophrenia or, delusions, anything like that, it's going to just feed back into itself. And, especially if you have like paranoia, those mentally ill thoughts start to take over, and you say, maybe it was the medication that was, causing my problem. So then you get even further away from treatment. And then now, you're in this place where, let's say you didn't have a lot of family or, somebody that was a caregiver that was looking after you. Now what do you do? So, in the current form of mental health care that we have in the country, I think it's improved a lot recently, but it still puts the onus on the individual to provide, really their own health insurance to pay for these treatments, right? So if you have somebody that has gone on kind of a spiral, they can get some kind of treatment if they seek it out, or as we talked about, they are kind of ordered to for a short period of time, but having some sort of support system that can help those people stay on a medication, that's really lacking in some of these more severe cases.
Correct. Yep.
So we've kind of changed our whole system of healthcare to be that privatized healthcare system, and we do have some public funding for mental health care, but that's not going to help these people who say can't work or haven't been working afford hospitalization, therapy, and medication.
My argument to that, though, is I don't think that publicly funded is necessarily the answer because of what we've already seen the public funding of this lead to, right? We saw the public funding of it caused overcrowding, which led to a lot of our very inhumane treatment of these people. Now, the argument can be made, okay, well, you can outlaw that treatment. I mean, just shoving ice picks in people's brains has always been illegal, right? Whether or not it's prosecuted that way or not is a different story, but I don't necessarily think that that's the common answer. I think there's a bunch of issues. With that podcast I sent you the other day, I was talking about a lot of them, is you can see a direct spike in the types of food we eat nowadays and the sharp spike in mental health. And I say that not to say that food is the scapegoat for mental health, because I don't think it is, but it's such a multifaceted issue that I think blanketing a huge economic requirement onto the nation, I don't necessarily think that's the answer.
No, and I agree with you. My whole point was just that it's a very complex issue, and as
Yes.
we talked about, the public funding of it, can be taken in, I don't want to say such a negative direction, but just an ineffective direction, or it can be crippled by just one piece of legislation or one court ruling. So what do you do when your privatized healthcare system isn't going to help a lot of these people, the type of people that are ending up homeless and committing serious crimes? Those are the type of people that would really benefit from some sort of universal mental health care type legislation. But at the same time, how do you put that into effect so that it's going to actually work, and that it's, like you were saying, not going to be just a giant financial strain on the country?
And what I think is a move in what I consider the right direction is, I think it comes down to organization, right? I think the state should be responsible for, and I mean that as the actual state, not the national state, for implementation. I think that should go down to a smaller scale, because like we saw in the history that we went through of this issue, my apologies, once it went from state to smaller, everything fell apart. And when it was at the national level, everything was too crowded, right? So I think the state was closest to the sweet spot. It definitely was not the sweet spot as far as everything was a gravy train at the state level. It seemed to have the most positive impact from what I saw, at least. Now, I'm sure there's people out there much more educated on the topic than me that are screaming that I'm wrong, but as for what I've read so far, that's my opinion. I do think there should be, and I'm very against what I'm about to say next typically, I do think there should be some sort of national funding for it. I think that if we collected national taxation for it and then moved that money to the states for allocation as far as how they set that up, I think that's good. I think there should also be national regulations on absolutely cannots, right? So we're not doing isolation. We're not doing lobotomies, obviously. We're not doing cruel and inhumane things that we wouldn't even allow in the Geneva Convention to be done to our own citizens. But short of that, I think that's where the national regulations should stop. I think at that point we go to a much more cultural question, which is what I think the states were designed to do in the first place. I think that we then have, California and Iowa might see the treatment of this very differently. Or Utah, for example, that is heavily Mormon. They might think that a religious approach, they might agree as a community that a religious element could be beneficial to mental health, which studies have shown that religion can be very beneficial for mental health. Where California may say, hey, we don't want any churches involved with this. This needs to be a state-run issue. They can have that vote at that point based on the population of that state. And I think that's what we should lean a little more into. Now, obviously, it's a little harder for people with mental illnesses to move to a state that is more beneficial to them or that's more in line with their belief system. But I don't think... I think that once you nationalize an issue, religion becomes much harder to incorporate within this program. Where at a state level, that's more possible if that's what the population deems to be more necessary at that point. You know what I mean?
Yeah, and I can definitely get behind some of that. So I think federal funding of some kind is probably necessary, as you were saying, and give the states some kind of a framework. So there is an interesting kind of comparison you can draw between what you are suggesting and the national highway system, where the federal government never mandated that you have speed limits of a certain type on your roads, right? Like Montana held out for many, many years to put speed limits on there, or at least fall in line with the speed limits of the rest of the country. And that was because the federal government didn't mandate it. They said, hey, if you want funding for these things, you have to fall into this framework.
And I think that also highlights beautifully why I think it should be a state issue, because in Montana, you have a lot more open space that you need to cover than you do in places like New York City or California or Florida, where you have much more densely populated states. So a 55-mile-an-hour speed limit in California could be very beneficial for the safety of the drivers and people on the road. Where in Montana, you can go 50 miles and not see another beating heart. You know what I mean? So that's another reason why I think the states being able to dictate what that funding is used for is important.
That is true, and I believe when you're talking about the interstate highways, it's more like 80 miles an hour, right? So, and as someone who's driven through Montana many times, I'll tell you that 80 miles an hour on Montana highways is really more of a suggestion, and
I think that's anywhere. Any speed limit's more of a suggestion.
I've rarely seen people pulled over on the side of the road in Montana. I would guess that you have to be going 90 plus.
Well, that's because the 4 cops in Montana are in a different county.
But anyway, so if you kind of do something like that with your federal funding, and you say, here we want all of these things to be, funded, but you have to fund it at the state level. This additional federal funding will come if you follow all these guidelines. Now you can legislate, I guess we already talked about, some of these things are federally legislated, and those things would still hold up. So the states wouldn't be able to, be confining people against their will.
Yeah, no, absolutely.
But let's say the federal government says, if you want this federal funding, you have to have some sort of, universal access to, say, outpatient therapy, or like a low income prescription program, something like that, right?
Absolutely.
Where the states don't necessarily have to fund that, but if they want that additional federal funding, they would fall in line with those.
Another thing that I think would be beneficial, that I don't know if it's going to come back to America, because everything is so national nowadays, simply because we have a lot more information on the national stage nowadays than we ever have in the history of the world, with the coming of the internet and television and things of that nature.
Putting everyone in a panopticon, is that what you were going to say?
No, I wasn't going to use that word, because I'm going to be honest with you, I couldn't define that word to you.
It's the type of prison or mental hospital where it's like a giant circle, so you never know if you're being watched or not. It's kind of like mind games and psychological torture.
Gotcha.
For prisoners. So it was a joke.
Gotcha.
But...
No, I understand the joke now. I think we look at everything from too large of a scale most of the time, and we try to blanket a lot of issues. One, for convenience, because it's a lot easier to pass a national law that impacts everybody the same way than it is to have states. We're seeing it now with abortion, where states get to make their individual laws, and a lot of people aren't happy with the states being able to make that. I think for most issues, though, the state should be able to do it, because at the end of the day, like we just said, conditions for each state are different state to state. The people within the state, people in Utah, are going to have vastly different moral beliefs than people in California, for example. Right? They're not going to see the world through the same lens even. So why should... And this is a problem also with pure democracies, is that the people... that the locations with congregations of people, large congregations, such as your Californias, Baltimore, LA, New York, Philly, Chicago, Detroit, all this stuff, start making decisions for the nation, where the needs are different. right, in small towns than they are in large cities. So I don't necessarily think, I say this again, for most policies, I don't think they should be done at a national level because people vary just so much. And this also ties into the land thing that we've always talked about for America, is we have so many people across so much land that the solutions and the problems themselves are vastly different from one location to another.
And I would agree with that for a lot of things. When you start to get into questions of what is a fundamental right of a person, that's when it gets a little more, it gets a little tricky on what people define that as and whether that should be a national or a state level. And that's not a, it's a very broad topic that we're not going to be able to nail down. Even for each individual issue, it could be different from person to person. But when you're talking about mental health and doing that, I think this is a good example of where it doesn't really matter if it's a big city or a small town. People suffer from these mental illnesses anywhere, and you can see somebody having a mental health crisis on a farm somewhere out in the middle of Iowa, like you were saying, or in downtown San Francisco.
However, one thing to be said about that is you do see a higher propensity of it per capita in larger cities, and this comes from my belief, at least, and I read a couple of things on it, but not too extensively. Human nature does not do well in high population density. You start to see higher concentrations of mental illness when people get stacked on top of each other.
You also have a bit of migration into the cities, because that's an easier place for people who
to get the help they want,
are struggling and living, especially with the homeless population, people that are living outside. It's easier for them to survive in a place where there are more abundant resources for people like that. And when I say that, I don't mean plants and rivers and streams. I mean like things like picnic benches, homeless shelters, even dumpsters with food to scavenge, things like that. So
but what I will say is that you see a lot more integrated communities in your more rural areas, right? I think this is one thing I think the churches excel at, whether it be regardless of denomination almost, where you see a lot more community outreach in rural areas of churches taking on people within their parish to help them, right? You see it very commonly in the Jewish community, where they'll take on a lot of economic problems of people within their parish just to be helpful, because their religion dictates that makes you a good person, right? Which is a problem, I think, in the nation, where we're starting to lose a little bit too much of the religion. I'm not a religious person, for clarity, and I'm not sure of your religious leanings, but I think religion historically has done a great job at helping with this issue, and I would be interested to see as to which has a higher concentration of religiousness, whether that be cities or more rural areas. I have my belief as to which one is more and less common, but I don't have any
and that would be an interesting statistic to take a look at, whether or not your per capita, like churches per capita or something, or like churchgoers per capita is higher or lower in a rural area. But I would say that I can definitely see where you're coming from, because if mental illnesses have a certain presentation among X amount of people per 100,000, right? If you're in a larger city, you have your X is larger, right? But if you're in a small city with maybe 2,000 people, or a small town with maybe 2,000 people, you have maybe 3 or 4 of these people that have mental illness, and that's probably easier for, that population to take care of, 3 people, because you don't need a large infrastructure or, multiple of these mental health professionals, paid on your,
In a
city
logistical chain
payroll and all
associated with that.
right? And it can be managed in a community level better, at that, kind of,
Which is yet
level.
another reason why I think it should be a state issue, opposed to a national legislative issue. You know what I mean?
Well, I think that's really more of a community issue rather than state versus national. But I do take your point as there being different needs for different communities. Now, there was another point that I wanted to make, and it's escaping me at the moment.
Should have took notes, man.
Yeah, I should have jotted it down while we were talking. Do you have anything else while I try and dig that back up from my brain?
Not on this topic. I mean, I can spiral off anytime, you know that, but
I think talking about mental health policy in America is it's kind of it's a thing that we're I think we're touching on a lot of good political points, and the state of things in America, kind of a microcosm of the political spectrum almost.
One thing that I also think is very unique with this issue, we've seen it with a couple of different issues, whether it be women's suffrage or slavery, is the people that aren't in it have to make the legislature for it. You know what I mean? So, for example, men had to vote for women to have the right. And where I think that's categorically wrong from a moral standpoint on the slavery issue and on the women's rights issue. I think both of those are inherent, and they should have been human rights from the beginning. Obviously, the culture of the times is dictating, or whatever the case may be, but I think it's very black and white clear what those things should be, right? Women should be equals. They should have all the same rights as men. Slaves should be free people. There should be no slavery in a civilized society. I think mental health is trickier because, one, there's not many diagnosed. I mean, we have our arguments as far as politicians go, whether or not they're mentally ill, but there's a much lower propensity.
Maybe they're all mentally ill.
Yeah, that's a whole different conversation. But for the vast majority, it's going to be people that aren't severely mentally ill making the decisions for those that are, which I think is much harder to see the compassionate side at that point. And it's a lot less clear, right? Like, nobody thinks that there should be no mental health treatment, but also nobody believes, not all of the people believe that everyone should be institutionalized if they're addicted to a substance, right? I think the left and right letter limits are very wide on this, and I think it's hard to narrow down, and you can't as easily go to somebody in it and ask their opinion because they could have a serious mental illness, right? You're not going to get a sound legal theory from a guy with paranoid schizophrenia, right? So it's
and that is true, but I think you could say that a survey of people who were homeless at one point and have gone through treatment.
Absolutely, yes.
Say like let's get some ideas from that population. Like what went wrong? What do you think could have been better? Like what can we do to better support people so that they don't have to go through what you went through, right? And,
absolutely.
Some of the things maybe not feasible, right? Like we can't necessarily provide a social safety net for every single person, but how do we get to 90%? Or somewhere something that we're okay with as a society. And I did actually remember what my other point was, and I can get back to it if you have something else to say.
No, I don't. Go ahead, send it.
Okay, so when we were talking about state versus national legislation, one thing that I think drives us wanting to make us as a country wanting to make policy at a national level versus leaving it up to the states is the United States is very different from all of the other Western or modern industrialized states or post-industrialist states, right? But at the same time, we do get compared to them directly by statistics, right? So when you talk about your national, GDP and your national, education levels and all of these things, crime rates, everything like that, it's very easy to just say, here are the stats for America and here are the stats for the UK or Australia or France, right? So now this is just me spitballing here, but I think it's probably very at the forefront of our national politicians' minds that when they see us falling behind as a nation, they want to do something about it on the national level and not say, we'll leave it to the states, right? Because then you have certain areas pulling ahead in some ways, other areas lagging behind in other ways, right? And you don't have that cohesive, what are we doing about mental health on a national level, or what are we doing about crime or drugs or education, right? So that's just kind of a thought that occurred to me.
Absolutely, and
I think that your national politicians are more likely to want to make things national level issues.
Mm-hmm. Job security. One issue I see with that, and this is why I think America is so unique, and it's becoming less and less unique in this fact, is our diversity, right? So it's very easy to govern from a national level if you have a homogenous society, right? Like your Norways, your Swedens, your Finlands, your things of those nature, where you got a homogenous society, it's easy to rule. Where in America, we have the beauty of diversity, right? Not only in the diversity of ethnicity or gender or sexual orientation, whatever the case may be, but a diversity in thought, which is why I think things need to be catered more to a state level to try to address those situations on smaller scales based on the diversity of information within that. You know what I mean?
Yeah, and I definitely agree. A lot of these issues are going to be state specific, and you do see a lot of really good state level legislation, and even states coming together to legislate things with kind of like interstate treaties almost. Mm-hmm. So like you have your whole Great Lakes Basin that comes together and legislates on how the waters
are protected
will be,
and such,
protected and all of that, and you also have others like Western states coming together for water conservation or resource sharing, things like that. So it definitely does work.
I also think what it helps with is you get to try a lot more solutions at one time than if you do it on a national level, right? So if you do a national policy, you're testing that one policy. And how to pick apart what works and what doesn't from that policy is a lot harder than if I have 30 different policies being tried across the country, and then we can say, okay, this works here, this works here, these two things both share this in common, that seems to work, but this side has this one thing that's been detrimental. Now we know, hey, we don't want to use a detrimental one, but this one that merged together really well that both states are doing is beneficial, so we should try that more across the stage that we're seeing, and that really gets diminished when you legislate on a national level. And I think the Founding Fathers saw that as well.
I can see the argument for that, definitely. Kind of let the states be the guinea pigs, or do a test run for all these different things and see what works and what doesn't. And if your system didn't work, but say Kentucky had a system that really did, then you can emulate Kentucky's system, right?
Exactly, and make tweaks for the local population.
When you're talking about the vision of the Founding Fathers versus what we have now, I think that brings up an interesting topic of the idea that the United States, for some of the founding fathers, the vision was that we would be a loose federation of states tied together under one, national identity. Kind of like what the idea for the European Union is, right? But especially in the last, I guess since, and I'm not a professional historian, obviously, but I would say since probably World War II, World War One, we've had this bigger sense of national identity in politics, right? So, I mean, I personally would like it if we kind of got back to that state level, and the federal government was kind of more of a loose tie together. But that does introduce a lot of complications, and a lot of these national, legislative topics, or a lot of the national legislation that we've had kind of doesn't work with that system anymore. So we would really have to.
I don't know that it wouldn't work.
To get back to that.
No, I agree with that. Okay, no, sorry, you brought it back to a spot where I agree. So I think that state government works very well in a lot of aspects, and I think the biggest is the diversity of thought. You see a lot of pockets of similar thinking where people congregate because they make their own echo chambers. But I which is why I don't think that national is good for the most part. I think, just in my belief in the core things that a national government should do, right? And I think this is important to frame out our thought patterns to help see why the other person sees what they see, whether it be between me and you or between me and anyone else, right? So I think the primary purpose of any government, not just ours, should be the protection of people and their property, and the ability to travel within the state. So this leads to national military, right? I think that is very important to protect us against foreign leaders in foreign countries. And I think that this also allows for policing, which I think is required. Another thing that I think is required for the government's role is to enforce contracts. This also comes into policing in the judiciary. But I think that's just about it as far as what a national government should be involved in. I can see an argument that there should be a way to conglomerate money from federal taxes and doling them out to states more in need than others. But that gets kind of hairy for me. So I don't think that a lot of these issues are the national government's issues, right? If they're not directly protecting people, and I don't mean protecting people from hearing stuff they don't want to hear. That's not at all what I mean. I mean physical protection of the people and the property of its people. Then I don't think the federal government should be inside of it.
Yeah, and so one thing that I will say is that personally, with our current system, I don't like the way that our system has evolved. I don't think that a lot of these things that have become national issues can now be, left to the states. Like, we can't just dissolve all of this framework that we've built over the last 100 years and just say now it's to the states. Like,
I think that's sunk cost fallacy.
Insane chaos.
I think that's a sunk cost fallacy. I don't think that that's the answer, to be completely honest.
And maybe it is, but my personal opinion is that almost anywhere that you create weakness, these giant private companies are going to pounce and take advantage, right? So when you start, repealing these national legislation or national, Supreme Court cases that set precedents for, things like the EPA and things like that, and you say, okay, well, we've done away with that, the states can decide, right? Now you're going to end up with a state that gets lobbied for billions of dollars in order to let them just destroy their...
Environmental protection is something else that I see that fits into my protection of property, right? So that is something that I see as a national issue because of public property, which is one of the very few socialist ideas that I agree with, is that our national park systems, our waterways, our things of that nature should be protected on a national level, because it is all of our property, right?
I don't think that falls under any kind of socialist policy. It's just, I don't think that big government is consistent with the ideas of socialism by default, right? Like, socialism is a system of, economic redistribution of wealth, basically, or, like taxation to provide things
for the common
rather than giving, the money to the people to spend, right? And generally, with the socialist economic system, your taxation rate is,
higher,
like an order of magnitude higher, almost. Not quite, but
pretty close, yeah. Much higher than privatized. Yes. My argument for that, though, would be that you are taking land, and instead of it being privatized so that individuals can buy it, you then acquiesce that land for the mass, right? For the people, which I think is socialist in nature. I think it's the same way, and we put funding towards that, right? From every individual pays taxes in, especially in Michigan, it's very common. I can only speak to that because that's one I'm most familiar with its laws. A lot of our hunters and outdoorsmen pay the vast majority of the environmental protection budget in America, as far as the preservation of wildlands that we have. So I think that is a socialist construct, that we are taking money from the individual to pool and put towards a social interest, i.e. public land. So this is just me defending. I do think that environmental protection and public land are both socialist ideals, and some of the only socialist ideals that I agree with.
So one of the things that I really like, I like to fight back on when people talk about, especially current American politicians wanting to, drive towards a socialist system of government and country. It's like one of the big things from socialism is that you have the government owning almost everything up and down, and legislating.
They monopolize
things like
everything.
Manufacturing. Yeah, so basically, you're manufacturing all the way up to your, marketing of goods and services in a fully socialist society.
And your pricing matrix.
Would be influenced by the federal government,
which was what directly led to the fall of the USSR.
Now, social policy. Yes, you can definitely say, those are socialist, in the socialist economic value, right? So like when you're talking about something like Medicare for all, or or universal health care rather, or these, if we're talking about those.
This is another issue that I'd love to get into, by the way.
Taxes into, to provide mental health for everybody universally, so that nobody has to pay out of pocket, and it's all provided by the government. That would be considered a socialist policy, right? And I don't think necessarily all socialist policies would be bad, but as we've said, the federal government does have a pretty good knack for fucking things up.
Everything up they touch. Another problem that I see with
the national parks are usually pretty good.
I think that was one of the best, short of beaten only by socialist products. Like, no, not even that. I'd say police and fire and EMS. Short of, and really not even EMS, just police and fire. I think those are the two best social programs that we have in America. When I think of traditional socialism, that's what I think, and I think that part of it is good. I think that
I don't think you can call the police socialist policy when it was kind of created in the direct opposite.
It was, but it no longer is, right? I think that
I do see what you mean, though. Paying taxes for a universal
good, yes.
Right.
So I agree with that. I agree with the national park systems. I agree with the national highways. I think that we start getting into the weeds on a lot of things, especially the welfare state as a whole. I think has been a negative impact on our country, and I think you can see that through multiple different things. One that my wife and I just happened to be talking about today, because I'm actually starting to get her a little more politically awake, even though she tends to lean more left than I do as well. Is that you have, for example, welfare cliffs, right, where you're decentivizing people from pulling themselves up by their bootstraps because they're getting benefits to the tune of multiple thousands of dollars a year, and then you give them a raise of 2%, which might only be a couple $100 different, but that pushes them over the bracket, so now they lose the $1,000 of benefits. So they have no interest in getting a better paying job unless it's markedly better paying to recuperate that loss of government benefits. I think that's a huge incentive issue that we have created as a nation that we need to fix. I don't know how.
No, I totally agree with that, and that is one big unintended consequence. And for anybody that doesn't know, anybody out there listening, this very well could be the first episode that actually goes out. I am a big supporter of social policy, these social programs, supporter of those welfare programs generally.
And
they're not always enacted well, but I do agree on principle for the most part. Now,
this is where you and I divulge a lot in our politics as well, I think.
Yeah, exactly. And, that's okay.
Mm-hmm. I encourage it. I think it's good for the country.
Get along. You're still my best friend. I don't care what your personal politics are, and I think it's actually really good to talk about it together.
I agree. So,
I think that's the only way. The whole point of this podcast.
Yep.
But my point was, you can do stuff when you see something like that. You don't need to say, throw the baby out with the bathwater, get rid of this welfare program, right? Or this social program that's, providing food for children and, like WIC or, like food stamps. I don't think they call it food stamps anymore. That's just some like weird political correctness stuff.
Yeah.
But anyway, my point stands. When you see something like a welfare cliff, right?
Mm-hmm.
Maybe instead of just doing away with the whole thing, just take that cliff and turn it into a ramp, right? So the more you earn, you just scale it back a little bit. That way you're not re-incentivized, right? Like it's a ramp off of that and not just it's kind of like how people have a giant misunderstanding of how tax brackets work, right? Like I've literally heard of people declining raises because they don't understand.
It's ludicrous. I had a guy that I knew almost do that as well, and I talked him out of it.
Honestly, if you're so stuck in your misunderstanding that you turned down a raise, maybe you didn't deserve it.
I think that's a failure of education, not a,
Yeah, I agree.
I think our public school system intentionally doesn't teach us about the tax system in order to benefit the government. Another problem I have with public schools.
I don't think that if you look at the federal education guidelines, I don't think it's as specific as you think.
No, it's not.
But that's a different topic.
Another social program, though. One issue I think we have currently, though, is that a lot of we're having this discussion where we think, hey, these are some changes that we can make to these social programs, right? But at a national level, there's not a politician, even Trump, who is one of the most outside of the political system politicians we've seen as president since Reagan, who are terrified to touch.
Even Reagan was politically indoctrinated fully by the time he became president. But yes, I take your point.
But you see what I'm saying? They're afraid to touch the largest expense that our nation has and the biggest contributor to our debt, which is these social programs.
The military.
No.
Oh, I see. The second biggest.
Military is second biggest. Well, actually third biggest, because first is our social programs with your Medicare, your welfare systems, your Social Security, all that stuff. The second is our debt payment, our interest payment, and then third is military. So for everyone that criticizes America for being a military industrial complex, there's validity there, but it's also not our number one expenditure or even our number two expenditure as of last year. So everyone's afraid to touch that. Trump has even vowed that he won't touch it. And obviously the Democratic Party doesn't touch it because a large portion of their platform is social programs. So nothing gets changed. So we're just stuck in this broken way, skyrocketing our national debt for our children to pay off. And it's clearly broken, right? It's clearly not working. And no one's going to do anything about it. Because voters want a solution to their problem until it comes time to pick which solution. You know what I mean? Everyone.
Yeah, I totally agree with the fact that, you know, politicians don't want to touch a lot of those programs because, you know, I mean, you can talk about improving them all day or like say, you know, we're gonna make it better in this way or that way, but when it really comes down to it, people vote with their wallets, right? And you know, if you are taking a program away from, you know, people that maybe they don't even normally vote, but that could just be enough to incentivize a huge wave of people to vote your ass out, right?
Mm-hmm. And that's the fear, though. That's why they don't want to touch them. And I think another large portion of it is lack of education. A lot of people don't understand how these systems work. I don't even understand how all of these systems work. And I would consider myself a relatively well-educated person.
I am constantly researching things. Like, I don't know the process for something the first time I do it, almost every time. And I have to do a ton of research, you know, like buying a house or getting a loan or, you know, paying taxes on something new that you haven't paid before.
Yep. No, it's crazy. And I think that a lot of people don't know how it works, and all they get is, oh, well, this person's going to try and take your benefits away. And so this is another reason why I think that a lot of these programs should occur at a state level instead of a national level, is because it's easier to pass something at a state level than it is a national level. And in the interest of progress, you're not going to make any progress on a lot of these issues at a national level just because of how difficult it is to get something passed nationally, right? So you'll see Congress put aside a bill and never vote on it, and it just dies in the halls of Congress, opposed to a state-level bill where they can get something done. And I think abortion shows this a little bit, is that you see states be able to put something into place and then adjust it left or right as they deem fit as a state, where in the national environment we see something get passed and then it doesn't get touched for 35 years. You know what I mean?
Yeah, that's true. Also, I think that the current state of national politics is kind of in such gridlock that it takes almost overwhelming support, like bipartisan support, for stuff to even consider passing a national bill at the moment, right? Or you squeak it through on just the bare thinnest margin that you possibly could, right? And you know, a good example of this is the daylight savings bill, right? National daylight savings bills have gone through one chamber and passed at least twice in my memory. And the most recent time, it was unanimous. And you know what happened after it went through? I can't remember if it was the House or the Senate first.
Yep, it dies in the other room.
It died. They didn't even take it to vote.
Yep. No,
because they have other things that they want to argue about, and you know, go back and forth and make a big, you know, national media storm about instead of actually passing policy.
And when's the last time you saw a national media storm pre the Roe v. Wade at a state level for almost anything? It's very rare, which is again why I say we need to stop doing everything at the bloated national level and start actually making progress to make this nation a better place, one state at a time. And now what your view of a better place is going to change person to person, but it also sparks the conversation within your local communities instead of people in California saying, I hate people in Texas, and people in Texas hating people from California. We're not even having the conversation anymore. If you like the way California is, move to California. If you like the way Texas is, move to Texas. Which we're actually seeing a lot nowadays.
And don't talk shit about somebody for moving to your state, right? Like,
I would agree with that.
Saying, oh, don't like, I don't want people from Texas or California moving to my state. You know, all they're doing is coming to your state because
I agree.
you know,
but
maybe opportunity is better, and maybe they want to, you know, they're going to share new ideas and bring new culture, right?
So I disagree with that. Personally, I think assimilation is important. If you're going somewhere, and I think this on a national level as well, for people coming to our countries, if you're going to go somewhere that is better than the place you're coming from, in your mind, you believe that that is run better. I don't know why people would move to somewhere they think is less better, with the exception of people that are forced move for jobs, obviously, and then want to go back to the same old policies that you encouraged elsewhere that ruined the place that you were and you decided to come to. For example, if you are someone who is pro-choice and you decide to leave Texas, don't go vote for pro-life measures in whatever state you move to, right? If you're from California and you don't like the really high tax rate, maybe don't move to Montana and decide that, hey, we should really have a state income tax. You know what I mean? I think you should assimilate to the culture you decide to go to, for the majority of the times. Obviously, there's individual circumstances that are a little different, but I don't think moving... And I think that if you do move to another state where people are governing the way that the populace wants to be governed, and then you decide to inject... The big example I see is all the mass... fleeing of people from California to more red states. Don't come from California to those places that you want to be at. Try to vote the same way you voted in California to get more of those California regulations, and then be like, I don't know why these Texans hate me. You know what I mean?
So yeah, I disagree with that, and we can talk about that more on a different episode or offline. But I definitely think that you know, spreading new ideas and you know, sticking to your values is important. Now, I can definitely agree with some of that. Like, hey, if you hate the fact that, you know, California has insanely high property taxes and, you know, all that kind of thing, maybe don't vote for that you know, school millage that is going to come right out of your property taxes, right? But
see,
you know,
well, I think what you're saying is,
I think it's very important for people coming to new places to you know, spread their ideas and, you know, maybe give some outside opinions on things.
I think that's very easy to say on an individual idea, like to individual idea, right? Your stance on this policy or this policy or this policy. Unfortunately, we're within a political rubric where there's only two choices. It's a dichotomy. So maybe if you didn't like the results of your state, and your state tends to go more towards that direction, whichever it may be, and you didn't like the results there, why would you then vote for the same direction in another state? Because they're not individual issues. Parties are almost like polar opposites on everything except apparently on not taxing tips nowadays. So
I think that one of the things that is kind of being simplified here is that people leave states and go to other states for a majority of different reasons, and you know, like the states aren't so different for the most part that you have to pick based on, you know, what the overwhelming politics of the region is, because it doesn't normally impact your day-to-day life that much, with the exception of things like taxes and, you know, that sort of thing, which I know you're all about, and you know, that's a big deal to you. Mm-hmm. For a lot of people, not that big of a deal, right? But for the most part, like, it's not affecting how you wake up and go to work and come home and live.
No, but it does affect the rate you pay for common goods, right? It affects a lot of different things in your day-to-day life, as even as close as grocery costs.
That's true, but all these, you know, these tech workers that are moving to Texas because they're building giant data centers and, you know, headquartering buildings there because it's a tax haven, basically. Mm-hmm. You know, they don't really care about that for the most part. You see what I mean?
But it does bring higher paying jobs to those areas, and that tax haven is an ideologically driven thing. You see them more commonly in red states than you do in blue states, which is why big business goes from blue states to red states. You see it all the time. So I don't think to say that you don't see it in your day-to-day is true. I guess you don't see it if you're not looking for it. but it definitely does impact you on a day-to-day level. Just the ability to get a job can come from, does that big tech guy want to come to Texas because it's a tax haven, or not, right? That could be the difference of 10,000 jobs in your community. You know what I mean? Like,
That
to
is
say
true.
that it doesn't
And,
have a daily
you know,
effect, I don't think is true.
we should
Yep,
start
we are
wrapping
over
up
time
here.
for sure.
So we'll kind of give our last little statements. But I will say, to your point, I did have some job offers in Texas, which I did not consider for many reasons. The biggest of which was wrong location. But I take your point for that.
Yeah, I think a lot of these decisions, people, and this will be my last tidbit, I think a lot of people see these as problems they don't have to worry about. But I think political suasions have been taught as a team game, and I don't think they are. I think that we need to address every issue as an individual issue and try each individual issue against our morals and make decisions based off that, not based off what the Republican National Party thinks or what the Democratic National Party thinks. I think we need to address each issue to our own individual moral fibers and decide that. I think the red till dead or the blue no matter who are both wrong. I
agree with that 100%, and that's why I disagreed with your ideas about not voting the same way as the state you came from statement. I think that you should vote with your moral compass.
Well, very well. I'm sure we'll have more on this topic in episodes to come, but I appreciate your time, Mike. It's always a pleasure to sit down with you.
Yeah, absolutely. And we'll be here talking and sharing our different views every time we sit down together.
Absolutely, so, buddy. And I think now's a good time we wrap. And until next time, I love you, brother.
I love you too. I'll see you next time.
See you next time, everybody. Thanks for watching.